Welcome to our dermatology clinic, where we are going to explore the fascinating world of chemical skin peeling. Chemical peels are a popular cosmetic procedure that can rejuvenate and refresh your skin, giving you a smoother and more youthful appearance. Chemical peels involve the application of a carefully formulated solution to the skin, which causes controlled exfoliation and removal of the top layers of damaged or dead skin cells. Before undergoing a chemical peel, it's crucial to consult with a qualified dermatologist or skincare professional. They will assess your skin type, concerns, and desired outcomes to determine the appropriate peel solution for you. During the procedure, the dermatologist will cleanse your skin thoroughly and then apply the chemical peel solution evenly to the treatment area. The solution contains specific acids or enzymes that work to exfoliate the skin and stimulate cell turnover. The depth and intensity of the peel depend on the type of solution used and the desired outcome. Superficial peels target the outermost layer of the skin, while medium and deep peels penetrate deeper into the skin for more significant results. Once the solution is applied, you may experience a mild tingling or warm sensation on your skin. This is normal and temporary. The duration of the peel will depend on the specific solution and your skin's reaction to it. After the appropriate amount of time, the dermatologist will neutralize the peel and thoroughly cleanse your skin. They may apply soothing creams or serums to help calm and hydrate the skin. Following a chemical peel, you can expect your skin to go through a process of renewal. Over the next few days to weeks, the treated skin will gradually slough off, revealing a fresher, more radiant complexion. Remember, after a chemical peel, it's essential to follow your dermatologist's instructions for post-treatment care. This may include gentle cleansing, moisturizing, and sun protection to help optimize your results and protect your newly rejuvenated skin.